You know how it is, you want to get a solid understanding of something complex, maybe something medical, without feeling like you need a PhD.
Right. You want the core info, but clearly.
Exactly. Well, that's what we're aiming for today on the deep dive. We're tackling a really interesting, though, well, thankfully not very common, health issue that can affect our dogs and cats.
Yeah, we're digging into granulomatous hepatitis in canines and felines. We've got some really detailed veterinary textbook information here.
And our mission, like always, is to pull out the key stuff, the need-to-know parts about this liver condition. It involves these unusual little clumps called granulomas.
That's right, granuloma.
We want to make it straightforward, informative, and definitely not feel like you're, cramming for a vet school exam. So, granulomatous hepatitis, it's a bit of a mouthful. What exactly are we talking about here?
Okay, let's break it down. It's an uncommon type of liver inflammation. Necroinflammatory is the technical term.
Necroinflammatory meaning cell death and inflammation.
Exactly. And the key feature, the thing that gives it its name, is the presence of these granulomas. Think of them as tiny organized clusters of immune cells.
Like little defensive huddles.
Kind of, yeah.
Yeah.
They're mostly histiocytes. Those are a type of macrophage, like the immune system's cleanup crew, but also lymphocytes, plasma cells, sometimes neutrophils too. And these little gatherings, they can disrupt the normal liver structure.
So they get in the way of how the liver's supposed to work, like little roadblocks.
That's a good way to put it. And it's important to know this isn't always just a liver problem. It can sometimes be part of a bigger systemic issue affecting other organs too,
Ah, okay. Like what other organs?
like the spleen, lymph nodes, maybe even bone marrow. The text also mentions copper granulomas specifically.
Copper granulomas. Different.
Yeah, they're linked to copper buildup disease in the liver.
Yeah.
You can actually see copper protein bits in them with special stains. So distinct from the general granulomatous hepatitis we're focusing on.
Got it. So these disruptive clumps form in the liver. Sometimes it's a sign of something bigger going on. What actually causes them? What kicks this whole process off?
Well, there's a pretty broad range of potential triggers. The textbook lays out several main categories. First up are infections.
Infections. Okay.
And that's a wide net. Bacteria, including some trickier ones like Mycobacteria, even chlamydia. Then you've got viruses, parasites like certain worms or flukes, protozoa, which are single-cell organisms, and fungi.
Wow. Okay. So lots of potential infectious culprits. Anything else besides bugs?
Oh, definitely. The body's own immune system can go a bit haywire. So immune-mediated conditions or problems with how the immune system regulates itself can trigger it.
The body attacking itself, essentially.
Or just not controlling the inflammation properly.
Yeah.
And here's something that might surprise people. Reactions to drugs, or even things like herbal and holistic supplements.
Really? Supplements, too.
Yes, the text specifically calls those out. Also, certain syndromes involving abnormal growth of those histiocyte cells,
Oh.
or even cancer of those cells, histiocytic neoplasia.
So infection, immune system issues, reactions to things we give them, even cancer. That sounds like a really tough puzzle to solve diagnostically.
It absolutely can be.
Yeah.
And the book goes on to explain how these triggers actually damage the liver. You get hepatocyte necrosis, that's liver cell death.
How does that happen?
It could be physical disruption, like the granulomas blocking tiny blood vessels, cutting off oxygen,
Yeah.
or direct damage from the immune cells themselves, or toxins.
Toxins. From where?
Could be from bacteria, but also
Yeah.
significantly from some of those herbal or holistic things we just mentioned. It really drives home that natural doesn't automatically mean safe.
That's a huge point. We often assume natural equals harmless.
Exactly. And how bad the liver damage gets really depends on where the granulomas are and how many there are. Some toxins target specific zones in the liver too. Yeah, different parts of the liver's functional unit. And the text mentions copper buildup in certain zones can make the injury worse there.
Okay, so location matters, density matters. What are the knock-on effects? What happens when the liver starts getting injured like this?
Well, damaged liver cells leak enzymes. That's something we often see on blood tests.
Right, the ALT, AST, ALP.
Exactly. If there's enough damage or if the bile ducts are involved, you can get hyperbilirubinemia, too much bilirubin in the blood.
Leading to jaundice.
Yes, that yellowing effect. Damage to the tiny blood vessels within the liver, the sinusoids, can increase pressure back towards the gut. That's portal hypertension.
And that can cause...
Ascites. Fluid buildup in the abdomen makes the belly look swollen. It can even cause the body to form new blood vessels that bypass the liver, entirely acquired portosystemic shunts.
That sounds really serious.
It is. If the granulomas are really widespread, it can lead to outright liver failure. And that brings a host of severe problems.
What?
Problems with blood clotting, bleeding into the gut, and hepatic encephalopathy. That's when toxins build up and affect the brain because the liver isn't filtering properly.
Oh, wow.
Yeah, the textbook stresses that liver failure disrupts metabolism broadly. Blood sugar, protein production, detoxification. It affects everything, and sadly, it's often fatal.
Definitely something critical. Now, who gets this?
Mm.
Are certain types of dogs or cats more prone?
Interestingly, no. The text says there doesn't seem to be a specific breed, sex, or age predisposition.
Huh.
But they do note it seems to be diagnosed more often in dogs than in cats.
Good to know. So if a pet does get this, what signs might an owner see? What makes a vet think, maybe this is it?
Often the first signs are quite vague, unfortunately. Things like lethargy, just being tired, less energy, loss of appetite, maybe some vomiting or diarrhea, weight loss, sometimes drinking or urinating more.
The classic ain't doing right signs that could be so many things.
Exactly. Then, on the physical exam, the vet might feel an enlarged liver, though sometimes it feels normal. The abdomen might be painful or distended if there's ascites.
Okay.
Sometimes the spleen or lymph nodes might be enlarged too. You might see jaundice, a fever, maybe rapid breathing.
Rapid breathing, why that?
Could be the ascites pushing on the diaphragm, or potentially the underlying disease process is affecting the lungs too, if it's systemic.
Ah, I see. And later stages.
In later, more severe stages, you might see more obvious signs like bruising or bleeding easily, a really swollen belly from fluid, and those neurological signs of hepatic encephalopathy we mentioned, confusion, circling, seizures.
Okay, those are definitely red flags. We touched on causes, but let's dig into specifics. You mentioned infections. Can you give some examples?
Sure. The textbook lists quite a few. For fungi, systemic things like histo, blasto, coccidioidio, even pythium.
Okay, bacteria.
Things like Brucella, Nocardia, Mycobacteria like TB relatives, Bartonella, also rickettsial diseases, the tick-borne stuff.
Parasites.
Yep. Visceral larval migrans, that's roundworm larvae wandering around. Liver flukes. In cats, feline infectious peritonitis virus is a big one, and Proteloa like Toxoplasma leishmania. It's quite the rogues gallery.
It really is a very diverse list. What about the non-infectious causes again? More specifics?
Right. Beyond infections, there's neoplasia cancer,
Yeah.
specifically cancers involving those histiocyte cells like histiocytic sarcoma or lymphoma. Also a more aggressive one called hemophagocytic histiocytic sarcoma. Then there are non-cancerous conditions where those histiocytes just multiply, abnormally reactive or proliferative histiocytosis, immune-mediated disease, as we said, drug reactions, and those xenobiotics, foreign chemicals.
Which includes?
Again, specifically calling out holistic or herbal remedies, also potentially treats or food ingredients from places with maybe less rigorous safety checks, and then sometimes after all the tests.
You still don't know?
Exactly.
Yeah.
Idiopathic. The cause remains unknown, which is always frustrating.
Massively. So with this huge list of possibilities, how do vets diagnose it? It must be like detective work.
It really is a diagnostic challenge. The vague signs, the long list of causes, the textbook stresses getting a super detailed history first. Any drugs, supplements, travel history, and thinking about other organs, spleen, bone marrow especially, to rule out those cancers.
Makes sense. Then I assume blood work, urine tests.
Absolutely. The basic panel, CBC, chemistry, urinalysis. The CBC might show inflammation, maybe stress signs, possibly anemia, often non-regenerative, meaning the body isn't making new red cells properly.
Okay.
You might see spherocytes, odd-shaped red cells, sometimes linked to immune issues, maybe high monocytes, a type of white blood cell, often up in chronic inflammation.
And the chemistry, what shows up there?
High liver enzymes are common, ALT, ALP, GGT. Bilirubin might be high, causing jaundice. Glucose can be variable, often low albumin, which is a key protein made by the liver, and low BUN, a waste product. Globulins, another protein type, are often high. Electrolytes might be off. And low cholesterol is sometimes seen with that hemophagocytic sarcoma.
So lots of potential clues there. Urinalysis.
Might be normal. Or you might see bilirubin spilling into the urine. Protein, maybe signs of inflammation like white or red blood cells.
Okay, so the initial blood and urine tests give pointers. What other lab tests help narrow things down?
Bile acids testing is useful, measuring them before and after a meal. High levels usually mean significant liver dysfunction or those shunts we talked about.
Right. Clotting tests.
Usually normal, unless the liver failure is really bad, end stage. We can also measure acute phase proteins, markers of inflammation.
What about testing for specific infections?
Serology antibody tests can be done, but interpretation needs care. Sometimes you need paired samples, one early and one later, to see if antibody levels are rising. useful for things like toxo or Bartonella.
And finding the bug itself.
Molecular tests like PCR or FIH on liver tissue can be very good for finding DNA or RNA from specific organisms, especially things like Mycobacteria or Bartonella that are hard to grow.
So cultures.
Yeah, you can try culturing liver, bile, or blood. But some bugs, like Mycobacteria, grow incredibly slowly, making PCR more practical. Special stains on the tissue can sometimes spot organisms, but they aren't foolproof. Especially for Mycobacteria, false negatives happen.
Any other tests? Like for autoimmune things?
You can check an antinuclear antibody, an ANA titer. It might be positive in something like lupus, but low positives aren't very specific.
Seems like a very thorough workup needed. What about imaging? X-rays, ultrasound.
Definitely helpful. X-rays might show an enlarged liver, maybe a mass, but if there's a lot of sightings, that fluid can hide things.
Ultrasound better that?
Often, yes. Ultrasound gives a better look at the liver's texture. Is it diffusely abnormal, or are there focal spots? It helps spot masses, checks other organs like the spleen and lymph nodes, confirms fluid, and crucially, it guides biopsies.
Biopsies. That sounds key. How do you get samples?
You can do fine needle aspirates, just sucking out some cells. Yeah. From the liver, spleen, lymph nodes, bone marrow, any fluid.
But that's just cells, right?
Right. For a definitive diagnosis of granulomatous hepatitis and the best shot at finding the cause, a liver biopsy taking a small piece of tissue is usually needed.
And what do you do with that tissue?
The textbook stresses.
Yeah.
Always do special stains for copper and quantify it, plus stains for infectious agents, gram stain for bacteria, specific ones for fungi, for mycobacteria, acid-fast stains, and depending on the case, maybe a bone marrow biopsy too, especially if cancer or systemic infection is suspected.
Okay, we've covered a lot. What it is, causes, signs, diagnosis. When you actually look at the liver tissue, what does it look like?
Grossly, with the naked eye, the liver is often enlarged, maybe firm. Edges might be rounded or blunt, could be bumpy. And you might see that abdominal fluid, the ascites.
And under the microscope.
That's where you see the hallmark, the granulomatous reaction, that collection of immune cells, histiocytes, lymphocytes, etc., disrupting the normal liver architecture. The pattern can vary.
Okay, so you've got the diagnosis. How do you treat it?
Treatment really depends on how sick the pet is. Severe cases need inpatient hospital care. Milder ones might be managed as outpatients. Supportive care is number one.
Neat.
Fluids are critical to correct dehydration and electrolyte imbalances. Sometimes glucose or potassium needs adding. Nutrition is also vital. We want to maintain a positive nitrogen balance, help the liver heal. Usually no protein restriction unless they have hepatic encephalopathy.
Right. And managing expectations.
Absolutely. It's important owners understand that some causes, like FIP in cats or certain cancers, are really difficult to confirm and treat effectively. And if it is copper-related, that's a whole separate treatment track.
What about specific drugs?
First, stop anything drug, herb, supplement that could be the cause. Then treatment targets the underlying issue if identified. Antibiotics for bacteria, antifungals for fungi, etc.
What if it's immune-mediated?
If you suspect an immune cause and you're confident infection is ruled out, then immunomodulatory drugs might be used.
And if it's idiopathic, the unknown cause?
That's tricky. Sometimes a combination of glucocorticoids, like prednisone, maybe with azathioprine or mycophenolate, is tried. But there's a big caution. These suppress the immune system. So if there is an underlying infection you miss,
You could make it much worse.
exactly, big risk. We also treat symptoms anti-nausea meds for vomiting, stomach protectants if there's concern about GI bleeding.
Makes sense. With all these potential causes, drugs for treatment, liver issues, any special worries about drug interactions?
Definitely. The liver processes many drugs, so if it's not working well, dosages of other meds might need adjusting. And that risk of immunosuppression uncovering infection is always there. Careful monitoring is crucial.
So once treatment starts, what's the follow-up like?
Close monitoring is key. Checking hydration, electrolytes, how the pet's doing overall. Regular blood work chemistry panels, maybe CBCs to track liver values and response. Sometimes repeat imaging or serology.
And what are the potential long-term problems?
Complications, things like chronic hepatitis developing. Scarring of the liver, fibrosis or cirrhosis, which is permanent damage. Progression to liver failure, despite treatment. And ongoing issues with blood clotting.
So pulling it all together, what's the overall outlook? The prognosis?
It really depends on the underlying cause and if it can be treated effectively. Because it's often linked to systemic disease, the overall prognosis is frequently guarded. Cautiously optimistic at best sometimes.
Okay, so our deep dive shows granulomatous hepatitis is this, well, complex liver condition in dogs and cats. These inflammatory clumps, granulomas, are the key feature,
Right.
and triggered by a huge range of things. Infections galore, immune issues, drug or supplement reactions, even cancer.
Which makes diagnosis a real challenge.
Yeah, needing detailed history, blood tests, imaging, often that liver biopsy with special stains. Treatment has to aim at the specific cause if you can find it, plus lots of supportive care.
That's a great summary. The text really drives home the need for a systematic, thorough approach because the pathways leading to this are so varied.
It really makes you think, though, doesn't it, when you consider all the potential triggers, including things we might think are harmless, like certain supplements or maybe even food sources from places with different safety standards. What does that say about broader pet health? It kind of highlights how interconnected their environment, everything they're exposed to, is with what's going on inside. It certainly makes you pause and think about carefully, considering all exposures, maybe things we wouldn't normally link to liver health,